Hailey Senior Home, and I'm a graduating senior from the University of Rhode Island with a degree in political science. Additionally, I am the president of the URI chapter of Students for Sensible Drug Policy, or SSDP. SSDP is an international organization working to end the war on drugs and promote evidence-based drug policies and harm reduction. Through my experiences in the URI Political Science Department and in SSDP, I've learned how for the past 4 decades, the United States has treated drug use as a moral and criminal problem, not a public health one. This approach has not worked. As you know, in recent years, we've seen a rise in opioid overdose deaths. The majority of these deaths can be attributed to heroin and other drugs adulterated with fentanyl. It's clear that fentanyl is a drug trend we're not going to be able to stop. As a result, we must take another approach. We must allow people who are using drugs to know what is in their supply. The benefits that come from this are immense. With the knowledge that a drug contains fentanyl, someone can decide not to use a substance, use less of it, or take other harm reduction precautions. All of these actions save lives. This proposed amendment to the Good Samaritan Overdose Prevention Act would allow people who use drugs to gain more information about the drugs that they are using, and it would provide legal protections for the local nonprofits who provide them with the materials to do so. If passed, this amendment would have major impacts on the lives of people who use drugs in Rhode Island. For example, my chapter of Students for Sensible Drug Policy at the University of Rhode Island would be legally protected and able to distribute fentanyl testing strips to students on our campus. With the rise of fentanyl in non-opioid drugs like cocaine, college students need drug testing materials more than ever before. SSDP wants to provide our peers with the materials they need, but under current law, fentanyl testing strips are a legal gray area, and we cannot take on the liability necessary to distribute them. SSDP and other important nonprofits in Rhode Island should not be forced to choose between taking on the liability that comes with distributing these drug testing materials or not providing life-saving resources to their communities. The Good Samaritan Overdose Prevention Act is common sense legislation that protects those who save lives in our communities. Adding the proposed protections for community members who distribute drug testing materials is a common sense amendment. I am proud of the fact that Rhode Island has led this country thus far in our progressive opioid harm reduction policies. We must continue to do so.